Viewers, welcome to a brand new video of IIMT Open House. Today in this segment of Meet the Author, we have with us Dr. Mallwika Sisodia. She is an associate professor in the Department of Conservative and Endodontics. Her career goal is to provide diverse clinical experience and conduct researches in the area of her expertise. Dr. Mallwika's long-term goal is to become an expert in her profession and to function effectively between interdisciplinary healthcare teams to utilize professional ethics, lifelong learning, and patient-centered care. Ma'am, it's an absolute privilege for us to have you here in our YouTube channel, IIMT Open House, and we are excited to know more about your book, Lasers in Dental Practices.
Thank you so much, Alok, for your kind word. Thank you so much, and I'm very much excited to tell more about my book.
Ma'am, so my first question would be, ma'am, how did you conceptualize this book?
So basically, the laser in dentistry nowadays it's very commercialized. The laser as an instrument to do the day-to-day doing the dental procedures. So that's why the laser come into the market around 1989 by the Johnson. From there, because it increase the treatment effectiveness as well as the precision without damaging the surrounding tissue. So
Okay.
this is the main benefit of the laser. So I want to write something which is very important, and as well as at the same time it is required also, means essential also.
So, ma'am, as you have seen your book about lasers and dentistry practice, so how are there any different kinds of laser for treatment of human beings?
Yes, actually, especially if we talk about the in dental practice, so laser broadly classified into two parts, the surgical one and the non-surgical one. Then again, it is subdivided, the surgical one subdivided into two parts, that is the hard tissue lasers and the soft tissue. Hard tissue laser, in which we need the laser which has a very high wavelength. For example, iridium based YAG, which is nothing but it is the crystal of the yttrium, aluminium, and garnet embedded in the iridium. And then coming to the soft tissue surgical part, so we had NDYAG and carbon dioxide based laser and diode laser. Whereas coming to the non-surgical part, so in that we have the laser for the diagnostic purpose, the low wavelength based laser, and other part of the laser. So the diagnostic one which we used is for the diagrodent to identify the dental caries, and the laser Doppler flowmetry, which is primarily used to see the vitality of the tooth structure. And then coming to the low level of low wavelength based laser, which is hardly used. And then coming to the other than that, so that is photodynamic disinfection, photo, and then the laser which we use to cure our restorative material, that is argon based laser.
Okay.
So the different type of wavelength is used in a different part of dentistry.
Okay. So, ma'am, how is it helpful in endodontics?
Actually, Alok, I am waiting for this question because being an endodontist, me myself, I know it is very important to irradiate the root canal, especially in cases of secondary infection case where the root canal has been already failed. Now, and in cases of large periapical lesion or the sinus tract region, so only with the help of sodium hypochlorite or with a syringe system, it won't go. So we need something which helps to remove the bacteria and the same time the disinfect also. So there is a system which is available, that is the uh, PAD system, this photo acoustic stemming system, and photo activated disinfection. In that we use the NDYAG based laser, which has the wavelength around 1049, and it used to irradiate the microorganism which is present inside the dentinal tubule, which is very minor. So it helps really in that situation. So uh, being an endodontist, we use this, and other than that, we use laser Doppler flowmetry to check the vitality of the tooth, and it is very important in cases of traumatic part. So it is very useful tools.
Ma'am, as you said, you are utilizing the laser treatment in endodontics. So, how does it works? How laser generally works in endodontics?
Uh, See, the laser works. Uh, Laser basically works. First of all, laser is a light which come from the instrument, which is very focused and narrow way of the beam, that light.
Okay.
But the interaction of the laser with the tissue, it depends upon the optical properties of the tissue. Like for example, if we talk about the heart tissue, the optical property of the heart tissue or the teeth is the different. But if we want to do something in the gingiva, so this optical property is different. So on the basis of light and the interaction of the tissue, it broadly classified into the four types: the reflection, scattering, absorption, and transmission. Among all, the absorption is the most desirable tissue interaction which we want. What happens when the laser light come and contact with the targeted tissue? So it converts those targeted tissue into the thermal energy. And this is how does it work.
So, ma'am, as you said, the laser gets contacted with the tissue. So, right, if are there any disadvantages or any kind of thing like if the tissue gets damaged or anything like that?
Actually, it's very important question also, that see, everything has some kind of limitation, and everything has a disadvantage. Like as I told you, the different wavelength which we are using has a something limited properties. Like if we use the NDYAG laser or diode laser for a long period of time, or if we couldn't manage the time period or the contact period between the tissue and the laser, so it will burn the area and it may cause the necrosis. So it is very, very important to, you should limit your contact as well. You should know that how much you want. And the second most important, as I told you, that it is having a very narrow and high wavelength. So it causes high damage to our retina. So it is prime most important thing to wear the goggles or the glasses for both the practitioner also and for the patient also, to protect their eyes. And then we can't use the laser in cases where the tissue is inflamed, because it causes necrosis and it is very harmful. And also where the anesthesia is given, so in that situation also laser can't work. So we should give little time, and we can't use in that situation.
And it's a personal question for me. Can if someone doesn't have an idea what is this about, can he or she have an idea while reading your book whether yes how this dentistry lasers and dentistry has been done? Can he get a clear cut idea or a basic idea?
Yeah, definitely, because I have mentioned everything about laser, like from Albert Einstein 1917, who invented the quantum theory of for the lasers. From there to what all the recent advancement of the laser till now, like the CAD CAM system recently we have, to see the to get the 3D print of the teeth. So from that, we I have mentioned each and everything about lasers, and in which area you will use that specific laser. And for your dental practice, how can you improve your clinical efficiency with the help of laser? And there are some tricks also is there, that how do you manage the crown lengthening cases. And there are 2 3 case reports also there, like different type of case study which has been already done. So what is their uh, takeaway for the laser till now? What we should learn from them? So I have mentioned everything. So I think it is very useful for the readers also, and for clinician also, like the for the student who is doing the post graduation and all. So for them also it is very useful.
Ma'am, any upcoming book from your side? Any new upcoming book?
Yes, actually, one has been already uh, on the publication has been already accepted for that. The rubber dam or the rubber dam application, because being a associate professor for me, I want every case has to be under rubber dam. And my student really, they don't want to place rubber dam for whatever reason. So I make them what all the importance of rubber dam and how you make it very easy for your patient also, for clinician also. So I have written that book, and I know it is very useful for my students. So these two and another book is also there that I will tell you once I will complete written part has been complete, then I will tell you.
Thank you so much, ma'am, for sparing your valuable time for us and interacting with us and letting us know about this new concept of laser practices in the dentistry part. Thank you so much, and have a nice day. Thank you.
Thank you, Alok. Thank you so much.